Hi, I'm Larry Downs, CEO of the Medical Society of New Jersey, and I'm here with Amanda Shiber, our Chief of Staff. And today we're going to discuss the disclosure requirements that impact all physicians under the New Jersey Out-of-Network Consumer Protection, Transparency, and Cost Containment and Accountability Act. So we're going to go through these slides in kind of a Q&A format, and we'll start first slide. Amanda, why don't we start with what physicians need to disclose under the new law, and then we'll talk a little bit about when they need to make that disclosure and what the best way to do that is. So what's the first thing that physicians need to be aware of when under their disclosure requirements under this law?
Well, first of all, I'd like to mention that this applies to all physicians, not just out of network. So the rules, or I'm sorry, the law really pulls all doctors into this, and no one doctor is really in network with everything. So the first disclosure that has to happen is a list of all participating health benefit plans and all affiliated facilities. And that has to happen before services happen.
So a physician needs to disclose all of the plans that they're under contract with and all the facilities that they're affiliated with or have privileges at.
Yes.
Okay. And then it looks like the second element of disclosure is to provide a list of those. Does that have to be in writing?
So first off, the list should be posted on the practice's website if they have it. And that's actually the best way to get that information out there and the easiest way to comply with the law. If the practice doesn't have a website, the information has to be provided to patients in writing, and that's where we get to, at the time of appointment, the patient should be told verbally, I don't participate in your plan, or I participate in your plan, and then given a list of the plans. If it's not available on the website, if you can't direct the patient to your website for a list of all the plans and facilities, then you should have a list to hand to patients at the time of the appointment.
So in terms of when this information needs to be disclosed, the list has to be, this list of participating health benefit plans and facilities needs to be disclosed prior to the provision of any services that are non-emergent, and also at the time of the appointment.
Yes.
So that's double disclosure, to do it twice?
I would actually recommend it 3 times. So I would recommend that they do this on the website. They do it when the patient calls for an appointment and when the patient comes in for an appointment again, especially when it's out of network care. You want to be really sure that the patient knows that it's out of network.
So what happens if the physician's participation status in a health plan changes? In other words, their contract comes up for renewal and they decide not to be a participating provider any longer with the patient's health plan.
As soon as they know, they should tell their patient. So if that patient had called and made an appointment 3 months in advance, and now they're no longer participating in that patient's health plan, they should really comb through their patient schedule and call those patients and tell them that, hey, we're no longer in this plan. Do you want to keep your appointment?
And you should also do that, I guess, if the patient shows up, you should do another disclosure
Yes.
that you're no longer participating with their plan, and then do that. And again, our recommendation is that occur both verbally and in writing, especially if it's going to increase the patient's financial responsibility for the care. So let's move on to when services are performed in a physician's office or physician refers a patient outside for some type of service. What's the elements that need to be disclosed to the patient?
So, to the extent available, so what the physician or practice knows, they have to provide the name, practice name, mailing address, telephone number, and of any healthcare providers who are going to be involved in their care. So that could be anesthesia, labs, pathology, radiology, assistant at surgery. Anyone who's touching the patient, if the practice knows that information, they should be giving that information to the patient.
So the basic idea here is that even though the referring physician isn't necessarily responsible for the service being provided, they need to let the patient know, if they know that the other people who are providing services, coordination with me, we need to let the patient know who they're going to see so that they can contact them and understand what their participation status
Right,
is with health
right.
insurance.
And also, the patient should be referred to their health plan or must be referred to their health benefit plan for more information on their costs as well.
And so, when does that disclosure need to happen?
Um, I think as soon as the information's known, if you know that the patient's scheduled for a surgery and that you're going to involve these other providers, that patient should be provided that information and it should be provided in writing.
What should a physician do when they're um, working, say, at a facility or a hospital, and they don't have any control over who will be assigned to a case? What do you recommend for those physicians to do when they know there'll be others involved, but they don't know their network participation status or the identity of those people?
We recommend that they provide the patient with the information or contact information for the facility to find that out, or for the physician to beforehand, if there's facilities that they're often going to, try to get that information from the facility up front so they have it for their patients. I've seen some communications where it says call XYZ hospital at their patient ombudsman for information. Others have the anesthesia practice listed out with their phone number, the lab with their phone number. But again, it's all just what they know. If you only know the healthcare facility and the healthcare facility is going to assign that assistant at surgery for you, that's all you can provide. That's what's known to you. You won't know the assistant at surgery till the day of surgery. That's up to the facility to provide that disclosure to the patient.
Okay, and what's the best way for physicians to make those disclosures? How should they do that?
I think they need to do it in writing.
And of course, keep a copy in the patient's chart, perhaps,
Yeah.
just so that if there is a discrepancy between whether that information was provided, the physician can produce a copy of what was given
Yeah,
to the patient.
I agree.
And then finally, we get to the point where there are disclosures that need to be made when services are scheduled or performed in an outpatient facility or an inpatient facility. What does the physician need to disclose in those situations?
So this is the same as the referral situation. You want the name, practice name, mailing address, telephone number of anyone else or any other physician or healthcare provider whose services will be arranged by the physician or scheduled at the time. This includes pre-admission testing, registration, anything during a non-emergency service that is scheduled beforehand. All of that information should be made available to the patient.
So the idea here is that we want to give the patient all the information they need so they can understand if there will be additional costs they might incur from this referral, and so that they can make different choices if they're seeing someone that's out of network.
Right. It's basically to help the patient to contact the other physicians involved or their practices to determine if that doctor's in their network, and then also referring the patient to their health benefit plan to verify that again, and to verify their out-of-pocket costs.
And then why don't we move on to when does this disclosure need to be made?
It's as soon as you know the information, the sooner the better. You want to provide this information to the patient when they're scheduling their appointment, as soon as you know who's involved in their care. So once you've scheduled their surgery, once you know what facility it's going to be in, you'll know what. I believe that most practices will know what facilities use what anesthesia services or groups. And as soon as you know that information, it should be disclosed.
And again, we certainly recommend that the information be disclosed in writing and as soon as possible or as soon as known. This is probably just a small adjustment to workflow for patients being routinely scheduled for facilities.
Yeah.
So that's the end of our presentation. I want to thank you for joining us today. And don't forget to download our guidance, which is available at www.msnj.org/OON for more information. Please feel free to contact our Member Resource Center at 609-896-1766, extension 0, or email us at info@msnj.org with any questions.